I think that most of you are familiar with Covid-19. We've been living with this disease for a few months now, but probably it's important to emphasize the fact that Covid-19 is a disease that is, it's a new disease that is caused by a recently identified virus, and the name of that virus is SARS-CoV-2. This virus belongs to a large family of viruses named the coronavirus. The first outbreak of this infection took place, in fact, in China, in the now famous city of Wuhan, and as far as we know, that probably took place in December 2019. This virus is closely related to other viruses that have caused problems in the past, SARS-CoV-1, and also another one which is named MERS. So this disease, typically, the first symptoms appear 2 to 14 days after exposure. Important to stress the fact that 20% of the patients are symptomatic. That means that many of them are totally asymptomatic. Important also to emphasize that 80% of the patients will recover without any treatment, but as we all know, many patients will have to be admitted in hospital, approximately 20%. 5% will need to be ventilated, and some of these patients will have to be admitted in ITU. And we know that the mortality, according to available data, is something like 1-2%. So this is what we know about the disease. We also know that the main symptoms are fever, people get tired, they develop chest symptoms such as cough, and they can also develop very severe chest infections, pneumonia with multiple complications. So this is what COVID-19 is, caused by a new virus causing mainly a chest infection. Well, to be fully honest, we don't have a lot of data. So we do not know exactly today, how many patients with hemophilia have been infected with that virus. I am aware of many studies currently being conducted to collect data about this. But it's very likely that the percentage of patients with hemophilia who got infected with the virus is not fundamentally different from the general population, because honestly, I don't see why patients with hemophilia should be more exposed to the virus. Clearly, it would depend, on where you live, on, your lifestyle. Also, it's clear that if, as a patient with hemophilia, you live in the center of a very busy city, if you have to take public transport, every day, you are much more at risk to be exposed to the virus compared to another patient who would live, in a suburban or a rural area with very few contacts with other people. So, but again, we don't have a lot of data about this, and it would be interesting to know, but I don't think that the exposure is fundamentally different for patients with hemophilia compared to other patients.